introduction for spirometry test is spirometry test is a fundamental pulmonary function test to assess lung performance by measuring the volume and flow of air during inhalation and exhalation. Spirometry also provides objective data on airway obstruction and lung capacity. This test is widely utilized in clinical setting due to simplicity, reliability, and ability to detect early change in lung function. And it is also making it essential tool in respiratory care in disease management.
So, before we dive into the objective of this spirometry test, we should know who might have this spirometry test. First, people with symptoms. Anyone experience symptoms like shortness of breathing, wheezing, or a persistent cough may advise to have this spirometry to investigate the lung problem. 2. People at risk, like anyone who exposed to lung irritants with dust, smoke, or certain chemical, or someone from family that have history of lung disease may be advised to undergo this spirometry test. Now I will talk about the objective of spirometry test. There is a three. First objective, of course, spirometry can identify earlier lung issue, even before the severe symptoms occurs, like various diseases like we know, such as asthma, COPD, and cystic fibrosis. Also, spirometry helping to track the progression of the impact from environment or occupational exposure on lung function. Second objective is spirometry help in pre and post-operative assessment, can use to evaluate lung function before surgery and monitoring recovery afterward. For the last objective is spirometry test help to evaluate treatment efficacy by helping determine if the medication or other therapy are improving lung function. That's all for the objective. I pass to the next slide.
So next is the method for this. The first one is participant. A few individuals were selected to perform the spirometry test. And also for the preparation, participants were told not to eat a heavy meal or smoke 2 hours before the test. They sat upright and wore a nose clip. Next, the procedure. Each person took a deep breath and blew into the spirometers as hard as possible. The test was done 3 times and the best result was used. For the tool used, a digital spirometer and disposable mouthpieces were used. Hygiene and accuracy.
For the spirometry test, the equipment used is the spirometer. The function of a spirometer is to measure how much air you can inhale and exhale. It is commonly used to assess lung function, especially for diagnosing and monitoring asthma, chronic obstructive pulmonary disease, or we can call COPD, and other respiratory conditions. There are 2 main measurements taken during a spirometry test. The first is called forced vital capacity. This is the total amount of air a person can exhale forcefully after taking a deep breath. The second is forced expiratory volume in 1 second, which shows how much air can be forcefully exhaled in the first and second.
Next is the procedure of spirometer test. The patient places a clean disposable mouthpiece into the mouth. The in-charge will ask the patient to take a deep breath in as much as they can. Seal their lips around the mouthpiece tightly. Blow out as hard and fast as possible until their lungs are empty, at least 6 seconds for adults. The test is usually repeated 3 times to ensure consistent result.
Good afternoon. So we will present about the result. So this is an example of spirometry test result. First is FBC, which is forced vital capacity, the total volume of air exhaled after a full inhalation. So this is a result of FBC. The first parameter we analyze is forced vital capacity of FVC. This is the total amount of air exhaled after a full inhalation. The patient result is 3.10 liters, which is 77.5% of the predicted 4.00 liters. Since it's below 80%, it is considered medley reduced, possibly indicating restricted lung volume. Next is FEV1, forced expiratory volume in 1 second, measures how much air is forcefully exhaled in 1 second. So this is the result of FEV1, which measures how much air is forcefully exhaled in the 1st second. The result is 2.00 liters compared to the predicted 3.20 liters, giving only 62.5%. This moderate reduction suggests airflow limitation, possibly to the condition like asthma or COPD. Third, FEV1 or FVC ratio. So this is the result of FEV1 or FVC ratio. We then look at the FEV1 or FVC ratio, which tells us how much of the air was exhaled in the 1st second. The result is 64.5%, which is lower than the expected 80%. A low ratio confirms obstruction, especially when combined with low FEV1.
PF is measure the maximum speed of airflow during exhalation. So this is the result for PF. So PF is basically peak expiratory flow, which measures the maximum speed of airflow. The patient scored 5.0 liters per second. This is only 66.7% of the predicted value, which may indicate weak effort or obstruction in the larger airways. So next is FDF 35 to 75%, which is the last parameter, is measure the average flow during the middle half of exhalation. The result is 2.1 L over S compared to the predicted 3.8 L over S, or 55.3%. This is moderately reduced and may show early signs of small airway diseases. So for calculation, this is the formula. Percentage of predicted equal to, in bracket, measure result over predicted times 100%. So percentage of predicted, we take from FBC, which is forced vital capacity. 3.10 is result divided by 4.00 predicted. So you will get 0.775. Next, 0.775 will multiply with 100%. So you will get 77.5%. spirometer, which is 1 divided by 3.10 liter, which is FVC, force vital capacity, you will get 0.645161 and more. Then you will convert the value here to percentage, so the number here will multiply by 100%, so you will get 64.5%.
Next, we go to the discussion. Reduced FVC, which is 77.5%, suggests a mild reduction in lung volume. This can occur in redistrict lung diseases such as pulmonary fibrosis, obesity-related hyperventilation, or neuromuscular disorders. FVC can also appear reduced in obstructive diseases due to air trapping. Next, we go to the FV1 or FVC ratio of 64.5% is below the lower limit of normal, which is typically more than 70%, which is consistent with an obstructive ventilatory pattern. This ratio reflects the amount of air expelled in the first second relative to the total air exhaled and is reduced when airway narrowing or obstruction delays airflow, as seen in asthma or chronic obstructive pulmonary diseases, COPD.
So, I will continue for the recommendation, which is ensure the patient avoids heavy meals, smoking, or vigorous exercise at least 2 hours before the test for accurate lung function readings. And always use a clean, disposable mouthpiece and calibrate the device regularly to prevent contamination and maintain accuracy. Observe the patient for any dizziness or shortness of breath after the test, especially in individuals with respiratory issue. And regular use of this spirometer, as directed by a healthcare professional, can help straighten breathing muscle and improve lung function. For the risk, the test may trigger an asthma attack, especially in patients with poorly controlled asthma. This can make breathing difficult and trigger coughing, a whistling sound, wheezing when you breathe out, and shortness of breath. And lastly, tuberculosis or acute respiratory infection can be exacerbated by the test and may pose a risk of spreading infection. That's all from me. I will pass to the next presenter.
Next, I will continue for the conclusion. The Spiro test is a key tool in exercise lung function. It helps detect conditions like COPD, it's chronic obstructive pulmonary disease, asthma, and recurrent lung disease by measuring values such as VEV and VVC. Besides diagnosis, it is also used to monitor disease progress and treatment effectiveness. Overall, it plays an important role in managing and preventing respiratory problems. So this is reference our groups. That's all from us. Thank you.